Welcome to HMI Unplugged. This is the podcast where we explore the stories, insights, and innovations shaping the future of healthcare management and informatics. I am Tanya.
And I'm Elena, and today we're talking with Chris Kunney from Iotech Consulting. Let's go ahead and get started.
So, Chris, before we dive in, could you introduce yourself to our listeners and tell us a bit about what you do and also how you became familiar with and involved in the HMI program?
Sure. Well, thank you so much for inviting me to be a part of this conversation. I'm very excited to have the discussion today, and I have been a longtime fan of the program there at Kennesaw and the work that's been done by people like Sweta and Tanya and Melina and everyone else that's been a part of the program. So thank you again for allowing me to share my story. My background is I stopped counting at 30. So 30 plus years in the tech space, over 20 plus of that in healthcare tech. And specifically, prior to coming into healthcare, I worked for companies like Hewlett Packard and Verso Technologies. And a few, I had a startup I ran during the first dot-com bubble. So I'm really dating myself. Um, but I've always had a career in the technology space. Actually, interesting enough, how I got into healthcare is as a result of serving as an adjunct professor, teaching at a local university. I was teaching a program on strategic thinking and problem solving. And I was telling my class, we were talking about industry trends and, understanding those trends and riding the momentum of those trends when they were taking place. And the trend at that time was health tech. And I was explaining to them that, healthcare at that time was really starting to embrace things like electronic health record systems and other types of IT technologies. And this is the perfect time to get into that space. And so one day I was brushing my teeth and I was looking at myself in the mirror and saying, hey, you're telling your students to get into health tech. Why aren't you trying to do the same thing? And so I embarked upon that journey of trying to pursue a career in health technology. I was fortunate enough to secure a job at a local health system here in Atlanta, Georgia, Piedmont Healthcare, where I served literally as the help desk and data center manager. And over a period of about 6 years or so, I eventually became CIO for the organization as well. I had the opportunity to lead Piedmont through a number of different transformational exercises. We were in the middle of installing our first electronic health record system during my tenure there. We launched a telemedicine program. We were actually the first hospital in the country to go through a HIPAA audit as well too. Another story for another day. And we had a chance to just experience a lot of the emerging transformation that was happening in the industry. Fast forward a couple of years after serving in that role, I went to the dark side and became a consultant and advisor, and worked for a boutique consulting firm for a while. I got recruited from that firm to work with AT&T. I was serving as an advisor for them, and they were launching their healthcare practice. And so they brought me on board to help lead that effort as their executive director for emerging healthcare technologies, help them bring on board their solutions. And then I was getting calls from other firms and organizations to serve as an advisor, companies like Samsung, Enrico, QTS, others. And so I launched my own consulting practice, Iotech Consulting. And during that period of time, I wore a number of different hats through that journey, serving as a fractional and virtual interim CIO, CTO, CISO for various different organizations across the country, an industry advisor for other technology companies. I helped launch a couple of technologies into the healthcare space, serving as the chief of strategy for a company called Juno Health. And most recently, I'm serving as a CTO for a couple of emerging tech companies, startups, and an investor in the startup community as well, too. And so I've been very passionate about emerging technologies, and I'm very passionate about things related to health equity as well, too. I served as an adjunct for Morehouse School of Medicine and their master's degree in informatics program in the past, and an advisor there. And I've served obviously as an advisor and supporter of the program here at Kennesaw State as well too. So again, just a little snapshot of my journey in this space.
Well, you truly had an amazing journey in health tech, and you've definitely completed the next question that we're going to ask. So we're going to go right on to the next question about what Iotech is solving today.
Sure. Yeah. So Iotech is a healthcare technology advisory and consulting and solutions firm. We work with, hospitals, physician practices, healthcare organizations who are looking to leverage technology as a key differentiator and providing a higher quality of care, improving operations, and serving the communities that they are ingrained in as well through the use of technology. So we do everything from advisory services and helping with developing strategies, implementing solutions, enterprise solutions, serving as interim leadership for some organizations, industry advisors for tech companies and health systems who are trying to understand, emerging technologies like agentic AI and other solutions that are really kind of getting all healthcare systems um, in a tizzy right now. And then we have a number of strategic partners that we work with that help to bring solutions to bear. So we do a lot of work in the cloud space, security, software development, CRM, and infrastructure as a service areas as well through our advisors. So in a nutshell, that's what we do. We are a boutique consulting firm that provides strategy and solutions to our clients.
And Chris, I'd love to know some of the key challenges you see that your clients face, and how are you helping them navigate these changes?
Yeah, it's a great question. The current environment in healthcare is really, it's so crazy right now, for lack of a better term. The new administration has obviously thrown a huge wrinkle in the way healthcare has normally been delivered. The funding models for healthcare have changed dramatically, and many of these organizations are now, quite honestly, kind of circling the wagons and trying to figure out how do we continue to maintain and survive with certain supplemental resources that have now been cut by the federal government. We're also seeing this emergence in things like AI and emerging technologies that are starting to get a foothold in healthcare, and the organizations are really trying to understand how do we maximize that, but also are very cautious about the implications of these technologies as they continue to emerge. And then organizations are trying to figure out how do they drive costs out of their organizations and continue to maximize the revenue that's coming in as well too. So looking for tools and technologies to help automate processes that may have been very manually driven and drive some of the costs out of that. Finding ways to capture more revenue through revenue cycle management platforms and solutions. Uh, Continue to move towards more precision medicine as we look at things like accountable care organizations who are focused more on a capitated financial model structure. And then for those who are just fighting to keep their lights on a day-to-day basis, making sure that it can deliver these services to those communities, especially when you get into rural health communities and underserved communities. How do we continue to provide services for them in this ever-changing marketplace today?
Thank you. And so, looking from trends shaping the future, from AI and wearables to data analytics, there's a lot happening in health tech. What trends do you see having the biggest impact in the next 3 to 5 years?
Oh, absolutely. I think the biggest trend that's happening is what they call the silver tsunami. And that is, by 2030, there will be more people over 60 than under 5 years of age. By 2050, we will have doubled the number of people across the world that are over 65. Over 2+5 billion people will be in their senior years. And so we've got we have literally a youth shortage. We don't have enough people who are going to be a part of the healthcare system to take care of this emerging market of baby boomers and Gen Xers who are now moving into their senior years. A lot of folks don't realize that The last baby boomers turned 60 last year, and the first Gen Xers turned 60 this year. And so a group of people who once were thought kind of as the young and emerging generation are really now moving into their senior years. And so we are seeing, those folks age out of healthcare, doctors and nurses and healthcare professionals who are now moving into their senior years. And then we're seeing, this rise in individuals who are now moving into their senior years and are going to continue to tax the healthcare system. Here in the U.S., we have, for those individuals over 65, they have at least one comorbidity issue, and 60% of them, about 50% of them, have two or more. And so those issues will continue to exacerbate the health system. And we have to move away from a model of just being reactive to care to trying to figure out how we keep people as healthy as possible. And along with the sandwich generation, which is you guys, you've got kids, that you're raising, and you've got adults, parents who are getting older, and you're in the middle of trying to navigate it all. And that's the challenge we have today primarily. And so you see this rise in what they call age tech or silver tech or granny tech. And that is right now, $15 trillion market, and will continue to grow. And these are technologies that are going to help these folks who are moving into their senior years age as healthy as they can, continue to maintain independent lives, allow you as the sandwich generation to continue to monitor and be caretakers for your loved ones, whether they're local or virtually. Through these technologies, and then just provide additional resources for healthcare providers who we're going to see a significant shortage of individuals. So I actually predict, in the next 5 years, you're going to have what I call the digital doctor. And that is literally an AI-driven platform that's going to provide some level of primary care without human intervention. Just because we're not going to have enough primary care physicians to take care of the population across the U.S. and across the globe. And I was in Qatar a couple weeks ago at a conference I was speaking at there, and this is not a U.S.-based issue. This is a global issue. Every marketplace across the globe is dealing with this crisis around this aging population. You've got communities like China, Japan, China having 1 billion people, and literally 40% of them are going to be over 65. And in the next decade it's a huge impact on their economy, their healthcare market, and it's a strategic imperative for every organization, every country, to figure out a model of care that's going to support this aging population.
Absolutely. And we'll have to schedule a follow-up conversation with you in 5 years to see if your prediction has come true.
Absolutely. Please do.
So you come with us with so many years of experience, and
Sure.
many of our listeners are grad students or early career professionals.
Mm-hmm.
What skills or mindsets do you think they need to thrive in the healthcare management and informatics space?
Yeah, it's a great question. Yeah, I think first and foremost, in this age of AI and automation, where everything is kind of done through technology, it's still a very hyper-competitive market out there for professionals who are now moving into this field. And just putting your resume out on LinkedIn and or the job boards and expecting healthcare organizations to find you, if the AI algorithms are designed in such a way that your resume isn't set up to, for it to pick up those keywords, you may not ever be seen by, a respected recruiter or a job seeker as well. So I think first and foremost, we still have to return back to the good old days of just networking with people, getting to know people within the respective organizations who ultimately will become your advocates as well too. There's people help those people they like and they know at the end of the day. And yeah, I can get 100 resumes in for a specific job, but if I know 2 or 3 people that submitted their resumes, I'm probably going to look for that resume first. And I'm probably going to be an advocate for those individuals first before I consider folks that I haven't had a relationship with. So I think it's imperative for the job seekers and the emerging leaders to make sure that they're plugged in to organizations where they get an opportunity to network and build relationships with healthcare leaders and healthcare professionals that can help open up doors and help mentor and coach them in that journey as well. And then I think it's also important for them to, because we're in the digital age and everyone goes to LinkedIn and social media platforms, you need to make sure that your personal brand reflects on those platforms your skill set, your ability, your knowledge, your active participation in discussions and thought leadership related to your area of your profession as well too. So I highly encourage people to make sure their LinkedIn profiles reflect who they are professionally, make sure that they're posting information out on a regular basis about thought leadership related to this space, even if it's just reposting someone else's article or commenting on it, getting involved in those digital groups on these platforms as well. The algorithms are designed in a way where they'll share your contact information with others who might be similar in the community, and it helps to build a broader community. Right now, I think I'm about to hit 20,000 followers on LinkedIn, which equates to probably several million people in terms of actual contacts, first and second level, third level contacts. And so that allows me the ability to continue to share our services as a company, my brand as a thought leader, and I get folks that reach out to me on a day-to-day basis asking for coaching and advice and direction about their careers in this space. And that opens up that opportunity for all the other seasoned leaders out there that are on these platforms to be resources for those folks too.
Well, we're definitely grateful for the collaboration that you've had with our program and the opportunity that you network with our students. And I know it brings great value to them. And before we close, we just want to take a look at one last question concerning equity and innovation.
Mm-hmm.
How can we make sure innovation doesn't just improve care, but it actually improves access and equity?
Again, another great question. I'm actually in the process of writing a book on the topic as well too. It's the thesis is why Black and brown people don't trust the U.S. healthcare system and how we can use technology to close the health equity gap as well too. I think first and foremost, it starts with having people from those underserved communities represented in these fields of study as well too. And I applaud, institutions like Kennesaw who are very, intentional about making sure that the individuals that go through their programs are very diverse, in their backgrounds, their cultures, their perspectives, whether it's, race, religion, age, all of that, I think has a huge factor in making sure that, people who are involved in the development, design, and use of these technologies look like the communities they serve, because they will become the biggest advocates as well, too. I think it's also important that, we include people from those communities in the design of these technologies. So often you have developers who are working in their garages or in their basements building technologies based on their perception and perspective of what they think individuals need, versus actually reaching into those communities that they're trying to serve and making sure they've got folks, end users, patients, and individuals who are going to be recipients of these technologies engaged, involved, and providing feedback about the solutions as well too. And then I do think there's, we talk about social determinants of health, but I think there's another term called political determinants of health, and that is how do we make sure that policies and legislation are also developed in a way that supports the development of technologies for underserved communities. And so we have to always advocate and lobby with our legislators for funding and laws that hold healthcare organizations and technology companies accountable for ensuring that that technology does no harm. It doesn't exasperate and perpetuate, systemic racism and bias issues as well, and that we have a governance structure in place that's constantly monitoring and holding us accountable for that going forward.
Thank you.
You're welcome.
Great. Thank you so much, Christopher. Appreciate it again, your time. So for you that hearing me, this is Hossein Mohit. I'm a program director for the HMI program and also faculty at the Coles College of Business here at Kennesaw State University. And again, thank you so much for your time. And I myself enjoyed the conversation and hope all the
Thank you.
audience enjoy it.
Thank you as well. Thank you for the opportunity. Look forward to continuing to support the program in the future as well.